Colombia records its first case of inflammatory syndrome in children linked to COVID-19. Eagle News correspondent Kathleen Cruz reports.
BC Provincial Health Officer Dr. Bonry Henry confirms its first case of multi-system inflammatory syndrome in children, or also called MIS, linking to COVID-19. On May this year, Canadian Pediatric Society alerted health practitioners of an acute inflammatory syndrome linked to children and teenagers aged 0 to 19. Children with this condition present similarities to Kawasaki disease and other inflammatory conditions of childhood, but there are other markers to confirm the syndrome, which is released by the World Health Organization. Symptoms with this disease can present abdominal pain, vomiting, diarrhea, rashes, shock, heart abnormalities, and other elevated markers of inflammation, in addition to positive laboratory tests of COVID-19.
We have had 16 children who have been under investigation. None of them have had any positive laboratory tests that would indicate they were associated with COVID. And today we did have one child, our first confirmed case of MISC here in British Columbia. This is a young child under age 5 who has been diagnosed with MISC once their serology test came back positive for COVID-19 this week. The child has fully recovered and is now at home. And to date, we, as I mentioned, have had 16 children who have been assessed for MISC but have not had any association with COVID-19.
According to Dr. Bonry Henry, currently all children hospitalized associated with COVID-19 and under investigation for MIS, with the guidelines from the World Health Organization, are being closely monitored, and team experts are supporting them to ensure that they understand what is happening, as affected patients can lead to severe problems and could lead to death. In Vancouver, Kathleen Cruz, Eagle News. We live in interesting times.